Hello there. We're talking about the risks of gonorrhea in pregnancy. Welcome to Your Health Today with Dr. Yide, where I talk about your health and wellness. I am Dr. Yide. If you're not yet subscribed to this channel, I know you're missing out. Why don't you subscribe right now and hit that notification bell so you get notifications every time I post new videos. Now straight to this chase, the risks of gonorrhea in pregnancy. Now we could divide these risks to the risks before delivery and after delivery. We'll start with before delivery. Before delivery, number one, the mother stands a risk of a miscarriage. Number two, it could be a preterm delivery, meaning the child is premature, the child is less than 37 weeks. The child might need incubator care. Number three, low birth weight from an intrauterine growth restriction, meaning the baby was not growing as expected, was growing less than expected due to the gonorrhea infection. So you can see why it's very important for pregnant women to be screened for gonorrhea. It can be very dangerous in pregnancy. Number four is premature rupture of membrane. Now the membrane is the amniotic covering, the covering around the baby. This is what protects the baby while the baby is still in the womb. If this ruptures too early, it can lead to an infection in the baby and the mother as well, chorioamnitis. This could lead to fetal and or maternal demise. We could lose both of them. So it is completely avoidable. So let's ensure that we screen our pregnant women for gonorrhea amongst other diseases. Then now let's talk about after delivery. What are the risks after delivery? The number one risk is blindness. It is very painful for you to grow blind. The child was born normal, but because of the mother had gonorrhea while attempting a normal delivery, all that gonorrhea around the vagina kicks into the baby's eyes. Gonorrhea is caused by a bacteria called Neisseria gonorrhea. Now this bacteria can damage the eyeballs during an attempt of normal delivery when the mother is pushing out the baby. The baby's head is going through that birth canal, the birth canal that is heavily laden with gonorrhea, Neisseria gonorrhea. This is very dangerous. It attacks the eyes and this baby can grow blind. So that's number one risk after delivery. Number two, pneumonia. This child is also predisposed to pneumonia infection, not an infection of the respiratory tract, the lungs. The very painful thing about this is that these things are completely avoidable. So please, let's ensure that we get screened for gonorrhea. Try to avoid it in the first place. Don't just have unprotected sexual intercourse anyhow. It is completely avoidable. So ensure that you get screened for gonorrhea every time you get pregnant, because you're dealing with two lives, yours and your baby's life. If you just love this video, I would have you like, post your comment, share, and subscribe to my YouTube channel. So we'll meet again, same place, same time next week. Don't forget, health is wealth. Bye.